Why weight matters. Type 2 diabetes can result from a combination of issues. Initially, the cells of the body are less responsive to insulin, a condition known as insulin resistance. Insulin resistance most commonly appears after excessive body fat. The pancreas needs to keep glucose levels in the normal range, which is why the pancreas secretes insulin. Over time, however, cells in the pancreas grow exhausted and release less of the hormone. Blood sugar continues to rise, and this sometimes causes type 2 diabetes. In type 1, the pancreas has evolved so that the cells do not generate insulin. Your genetic makeup is a factor in the development of diabetes, as is true for a lot of common diseases. Researchers have identified more than 100 genes that relate to the onset of diabetes, but each one accounts for only a small risk factor. Advancing age also increases the likelihood of type 2 diabetes, which usually strikes people ages 45 and older. About 1 in 4 Americans older than 65 has diabetes, including undiagnosed cases. You cannot change your biological age or your genes. There is still a lot you can do to prevent or work against type 2 diabetes. One big thing you can do is to maintain a healthy diet and exercise. According to a medical saying, genes are responsible for maintaining your health, but attitude and lifestyle can work out the trigger. Even if you have inherited genes that confer risk for diabetes, you may not know whether you have the disease. Or, if you have it, you can help control it by controlling your weight. Regaining a healthy weight is of great importance when it comes to avoiding diabetes. The National Institute of Diabetes and Digestive and Kidney Diseases, NIDC, asserts that 80% of people with type 2 diabetes have a BMI of 18.5 to 24.9. A measurement of 25 or more indicates that you are overweight. You have an overall BMI of 30 or more points if you belong to one of these categories of obesity. These categories were developed in accordance with life insurance data that showed an unfavorable influence on lifespan from being overweight and an even greater influence on mortality from obesity. It's wise to pay close attention to blood sugar. The risk of becoming diabetic rises in accord with blood sugar levels. More intently your blood sugar level, increase the chance of obtaining diabetes. If your fasting blood sugar level is from 100 to 125 mg DL, you have what has been termed prediabetes. An individual's blood glucose level of 126 mg DL or over indicates the chance of diabetes is elevated. Approximately 84 million individuals between the age of 20 and 69 have prediabetes, making them more likely to have diabetes than their blood sugar level readings would suggest. Those with prediabetes, like diabetics, are overweight and have high blood pressure. Matthew, cancer/stroke patient whose Ph.D. was obtained at 65, asks you to help him raise awareness of health issues by sharing this valuable information. Please take the time to subscribe to and like this video.